Veteran, this Junior Bennett coming to you live from Atlanta, Georgia. I am 100% permanent and total disabled veteran from the Desert Storm area. Today's message, I'm going to talk about the 5 nerve branches of your lower extremities. And why am I talking about the 5 nerve branches of the lower extremities? It's to give you an unfair advantage when it comes to a high value claim. We already know to get a high value claim, you need some 70s with 250s to get 100. You need 230s to make a 50. It's all kind of crazy math. So today I'm going to talk about musculoskeletal issues dealing with your lower extremities. Okay, we're going to talk about the nerve branches of the lower extremities. There are 5 nerve branches. Okay, just like branches of a tree, you have the base, you have the tree there, you have a couple of branches trimming out there, branches there, you got branches over here. Well, in the lower extremities, as far as nerves are concerned, you have the sciatic nerve, which is the number 1 nerve, okay? In the sciatic nerve, you have different branches of the sciatic nerve: peroneal, popliteal, musculocutaneous, anterior tibial nerve. These are different branches off the sciatic nerve. So you got, this is considered your sciatic nerve here, and then you got different branches. Now they control the buttocks, the leg, the knee, muscles below the knee, lower leg, fibula, the toes, the foot, the plantar flexion, the sole of your foot. The sciatic nerve controls those things, right? And then you have the femoral nerve. The femoral nerve is an anterior nerve, the internal nerve, the crural nerve, the sapropharyngeal nerve. I can't pronounce all those words, but they control the front of the thigh, the quads, and your calf, your medial calf, that nerve there. Then we have the obturator nerve, which is the hip and muscles of the hip and the medial thigh. That's what it controls. Then the 4th one, you have the external cutaneous nerve of the thigh. All right. This is a sensory function of the lateral thigh. So you got different nerves. We got the 5th nerve is the ilioinguinal nerve. That's the lower abdominal wall and your thigh. The lower abdominal wall and your thigh. You're probably saying, Lord, have mercy. There's a lot of different things with the lower extremity. Yes. What does it mean to you? I want to give you a complete example. If you're trying to get a high value claim at 80 to 100%, you're dealing with musculoskeletal issues, all right, which I'm going to give you an example. A veteran has a paralysis of the common peroneal nerve. The peroneal nerve is inside of the sciatic nerve. All right. So the veteran still has a mild paralysis in the femoral nerve. Okay. So that's another nerve. You got the femoral nerve is impacted on a mild stage, but the most of the pain is in the sciatic nerve. Well, the VA rater at your regional office is going to make 2 ratings. 2 ratings. I want you to understand. There's going to be a 30% rating on your peroneal nerve that's in the sciatic, and then he's going to give you a 10% in the femoral nerve. So you might think you're only going to get rated for one thing in your leg, for instance. Well, there's nerves in your leg that in the sciatic nerve and the femoral nerve. So you may have more than 2 ratings. You may have 3 ratings, just depending on the severity of your particular injury. So how do you determine that? You know, and I know that you're not medically inclined or licensed or board certified in the medical field to be able to diagnose, examine, and predict the severity of the rating unless you go to an orthopedic surgeon. All right. That's why I'm telling you it is imperative that if you're going to be a sharpshooter, if you will, when it comes to your VA disability, you have to go through training. That's what the New Life Veterans program comes in. We're going to enroll you into the New Life Insider program and educate you and get you to be a sharpshooter. The only way you got to be going to be a sharpshooter is you got to practice over and over again. That's the reason why we're going to give you a free Facebook group to practice with other veterans. You're going to also have resources in the announcements tab and the files tab. And when you get the big ultimate coach, which is myself, to help you become a sharpshooter by enrolling to the New Life Insider program. We're going to get on the phone. We're going to talk. We're going to strategize. We're going to find out which extremities that we're dealing with. Upper extremities and lower extremities are totally different. You get individually rated from your upper extremities, all right? But you can get multiple ratings from your lower extremities, all right? So what I can tell you to do right now, you don't have to become a medical expert. You don't have to become a doctor to do VA disability. What you got to do is get a free consultation at newlifeveterans.com. We'll be able to get on the phone and find out what's your issues and direct you in the right path to the right board certified physician. Because I'm going to tell you, you're going to fill out that 526EZ application, submitting a claim to Janesville, Wisconsin, without the proper training to be a sharpshooter. You're going to submit it without a medical nexus from your private examination. You're just going to go off your family statements with the lay statements, your own statement, and you're going to submit, say, you know what, they know my injury was in the military, and they know I've been going to the VA for this same injury. They can make a determination. There's a link. You're wrong. If you don't meet element 3 of service connection, I don't care if you got the new diagnosis. I've had newer diagnosis with tinnitus. I've had the rating of an aviation technician where I worked on a flight deck, okay? If I don't have a medical nexus from an audiologist, I can kiss that rating goodbye for 10% for tinnitus, all right? So these are rated high. I would not skip out on a musculoskeletal rating if I were you. If your ultimate goal is to get the 100% or 100% permanent total, you got to pull out every piece of artillery when it comes to your VA disability, because at the end of the day, your commanding officer of the past has went on with their life. You have to deal with the VA, not your commanding officer or anyone you serve with. You got to take care of you and your family. And if you are sick and tired of hearing misinformation, if you're sick and tired of filing over and over again and failing, stop right now today. I want you to look below this video. There's a New Life Veterans link in the comment section. I want you to click right now. Let's get a telephone consultation and get you the highest rating that you and your family deserve. Thank you so much for watching this video. God bless and stay tuned. Like the video, subscribe to our channel, and let's win your claim.